In addition to tilting forward, the bed can also be tilted backwards into what we call Trendelenburg position, which has three primary benefits. The first is that you can use it to help reposition in bed by allowing gravity to assist in getting closer to the headboard. This can be especially helpful for caregivers as well as users, which is why some people call it the boost position. Secondary, users experiencing swelling in their lower legs and feet can utilize this position to get the feet elevated equal to or higher than the knees. Finally, and most important, is the use of the zero gravity or 0G position. By tilting the bed backwards, elevating the knees, and raising the backrest to a comfortable height, you'll find the exact right position to reduce and relieve back pain and pressure, especially in the lower back.